After years of talk at the federal level in a historic move, the U.S. Drug Enforcement Administration is moving toward reclassifying marijuana as a less dangerous drug.
Texas allows marijuana use for medical reasons. KVUE's Darynisha Heron spoke with a Texas doctor that writes most of the cannabis prescriptions here in the state about what this could mean.
Behind these doors, Dr. Matthew Brimberry handles business as a family physician, hospice care provider, and medical director of Texas Cannabis Clinic.
So when Texas legalized cannabis for our terminal cancer patients, I was in line at the Department of Public Safety to get my patients safe legal access to this medicine.
He's been part of the fight to expand medical marijuana access in Texas. And now sources tell national media outlets the Federal Drug Enforcement Administration is closer to reclassifying marijuana as a less dangerous drug.
This is an exciting time.
The plan would not legalize marijuana at the federal level, but it would reclassify it from a Schedule I drug like cocaine, believed to be highly dangerous and addictive, to a Schedule III drug that can be lawfully prescribed as medication like Tylenol with codeine.
It would give opportunities to also have more research done because currently at a federal level, that's not even possible except for one university down south.
Research that could possibly help prove what Dr. Brimberry is already seeing with his patients in Texas.
Anything from autistic children that could finally calm down and learn how to speak and engage with their peers, all the way up to multiple sclerosis patients, that their pain and their spasticity was finally controlled and they can go back to work.
Brimberry says it will also destigmatize the medical use of cannabis, so more people are open to using it instead of addictive opioids. Right now, 79,000 patients are registered in the state's compassionate use program, but Brimberry believes 3 to 5 million people actually qualify.
We're in a unique situation to where we actually have the infrastructure to support the rescheduling of this medicine.
That's because Texas already requires prescription for usage, so we have the software. And while the Texas legislature will ultimately decide cannabis laws in the state, both believe this change could change the mind of lawmakers to expand medical marijuana use for a range of needs. In Austin, Darynisha Heron, KVUE News.
Darynisha, thank you. Now, the DEA still has to take public comment before this reclassification can take effect. Attorney Michelle Donovan believes with it being an election year, it could be done by September.